As I mentioned, Biden's national plan amounts to nothing more than rolling shutdowns that are going to destroy our own country. For more on that, we're joined by White House COVID advisor, Dr. Scott Atlas, who was just dubbed the anti-lockdown coronavirus advisor by the esteemed journal Business Insider. Dr. Atlas, you've just risen in my estimation, if that's even possible, but that nickname. You've said that the president's diagnosis will not change how the White House tackles the pandemic. Why is that?
Thanks for having me, Laura. Well, of course it won't change. I mean, obviously, the strategy is the same, and the president articulated this presciently, really, in the third week of March when he said that the cure cannot be worse than the problem. And so the strategy is highly aggressive, targeted protection of the vulnerable and opening up schools and society, because he early on recognized that the policy that many of the public health officials espouse and many of our governors espouse, which is stopping COVID-19 at all costs, is very destructive, because as we've learned all over the world, the prolonged lockdown is super harmful. I mean, we just had a study come out yesterday which showed that 46% of the top 6 cancers went undiagnosed during the first 3 months of this lockdown. And what that means is more than half of breast cancers, by the way. This is just the tip of the iceberg. It's not just that hospitals were closed, it's that there was fear instilled, sort of a frenzy of fear in the American public and all over the world. And so what we see are 650,000 people that were on chemotherapy. Half didn't get their chemo. We had 2/3 of cancer screenings not get done. Half of childhood immunizations weren't getting done. And the other impacts are even more harmful. 25% of kids in the United States, 18 to 24, 1/4 had suicidal ideation during the month of June. I mean, this is so destructive, not just to our children who are being harmed by the school closures, but really this lockdown is what I would call a luxury of the rich. This is really a class problem here, where the affluent elites don't understand that what the president understands, which is people need to work, the working class needs their jobs, children need to go to school, and it's very harmful to do otherwise.
Yeah, the poor have disproportionately been affected by lockdowns, and they're doing better, the working class people in the states that have reopened, where almost all of those are Republican-led states, because they believe in freedom and not fear. By the way, Dr. Atlas, I have to talk about part of what Joe Biden said today in his Gettysburg address about how he would tackle COVID. Watch.
Let's just set partisanship aside. Let's end the politics and follow the science. Wearing a mask is not a political statement. It's a scientific recommendation. We're going to have a national strategy that will make it possible for our schools and businesses to open safely.
Dr. Atlas, when he says national strategy, what does he really mean there?
Well, I cannot speak for Mr. Biden, but I can say this, that there is a complete fallacy that President Trump is not following the science. President Trump follows the science. He listens to people both inside government, public health officials, and he also gets information from the actual academic scientists, medical scientists, epidemiologists from places like Harvard and Stanford and Oxford, top people in the world. And these people actually agree very much with his strategy. Protect the vulnerable as much as you can and open up because of the harms of that. This is a national strategy. The president articulated, he says it all the time, and in the meantime, he's doing a lot of great things, like he showed actually as a patient recently, like Operation Warp Speed with new drug development, facilitating the record timing of a safe and effective vaccine that we anticipate very soon. And, the hospitalizations have gone way down.
Hospitalizations are way down. Deaths are way down. That's all good news. And the media just refuse to report it. They just will not report it, because we're going to kill the country off to make sure we have not a single person infected with the virus in the United States. That's their plan. Biden's plan are rolling lockdowns, because his advisors have already said that's what we should have done initially, is to keep it going. But I have to ask you about this, because when we see the president come on the balcony and he takes his mask off to do that, video, which was, a lot of people love the video. He just got reamed by all the COVID panic squad in the media, saying he's a walking vector of disease and a cloud of contagion in the White House, and people are dropping like flies. What is your response on the specific issue of the symbol of the mask and the president taking it off?
Well, listen, the president, he respects the disease, and I don't think anyone should think he's minimizing the seriousness of this disease. It's highly dangerous for people in the category of high risk, elderly, and, people with comorbidities. But, he's, we're all thrilled, actually, how well he's doing. I saw him, actually, earlier this evening. It's amazing. The guy is incredibly resilient, and that's fantastic. But that does not minimize his concern, and he's following all of the recommended guidelines for someone who's sick. When he's around people, people enter his area. He has a mask. Everyone else has a mask on. I mean, it's very clear. This is very dangerous for people. When you're symptomatic, there are certain guidelines to follow, and his policy is really the reasonable policy. It's the policy of the NIH. I just looked it up, which is wear a mask when you cannot socially distance. There's no sort of cavalier attitude whatsoever. But he did very well. He's doing very well, and he came home. He took his mask off. He was outside. I think the media is making something out of nothing here, really.
Yeah. Now, Dr. Fauci responded to the president comparing COVID to the flu earlier in a tweet. Watch.
The numbers speak for themselves. This is not a trivial disease. You don't get a pandemic that kills 1 million people, and it isn't even over yet with influenza.
And big tech, Dr. Atlas, is once again trying to silence the president. NPR reporting that Facebook, Twitter take action against Trump falsely claims that the flu is deadlier than COVID-19. But check this out. We did this research ourselves tonight. For those 24 and under, it's actually less deadly. The flu is the COVID is less deadly than the flu. Look at the numbers. 434 for those ages 0 to 18, that's the flu, and 429 COVID deaths going all the way up to 24. So he was right in that key age group that is trying to go back to school and college and so forth. So we are keeping kids out of school for a disease that is less deadly than the flu. That is correct according to the CDC numbers, correct?
Well, I mean, it's not just correct according to CDC. There's no question that the president was talking about in some populations, and he's talking about the younger people, children. The COVID-19 is less dangerous than seasonal flu. That's on the basis of deaths. It's on the basis of hospitalizations. It's been stated exactly that by a journal, JAMA Pediatrics. This is not really, arguable.
Right.
And they're trying to, again, make something that he really didn't mean. What he's saying is that in certain populations, it's less dangerous than the flu.
Well, that's a big population.
About kids, and that's just scientifically factual.
So I just want everyone to understand this tonight. We got to roll, Dr. Alice. Thank you so much. But I want people to understand this. Twitter and Facebook are censoring the president of the United States under false pretenses. The facts are against them. The flu for that population, the younger people, is more deadly than COVID. Period. Those are the stats. And they're censoring the president over that. Unbelievable. That's the country we live in. And no wonder they're giving all the money to the Obama